Therapeutic communication and documentation. All right. So as a paramedic on scene, you're the medical authority. You are the medical expert on scene. You provide the focal points for communication with the patient. The first contact you make with the patient establishes the foundation for patient rapport. If you come at them with a lot of attitude, not believing them, it's going to influence the way that the whole assessment goes. If you come at them with compassion and advocating for them, it's going to go better for you. Your immediate first impression upon entering the scene allows you to choose the type of interview to conduct. You need to establish the urgency, be respectful. You're being invited to their home. Clearly state your name and role. This establishes the initial trust. I always start off with, hey, I'm Carl. I'm a paramedic. What's your name? Hey, John. John, what's going on today? And I'll also write the name John down on my glove because I forget people's names really badly. But I can't forget if it's written on my glove. Maintaining eye contact is important. Respecting personal space. There's lots of different things they might ask you, like Western culture, Native Americans don't make eye contact, this and that, whatever. Ask them what they're comfortable with. Realistically, it's less of a cultural concern and more of an individualistic concern. Some people just don't like make eye contact. Some people don't like physical touch. Some people really helps them. Read the situation. Ask your patient what they're comfortable with. As long as you approach the situation with a relaxed demeanor, it's going to help the thing. If you come into a situation with a lot of amped up energy, it's just going to amp up the situation more. The best captains and the best paramedics I've worked with, they're cool as a cucumber the whole way through. That's just going to make everything facilitate a lot easier. Don't interrupt your patient. Use close-ended questions when needed. So don't ask them, how have you been feeling? Ask, have you been feeling sick, right? It's easier to get yes or no answers from them. Don't ask them leading questions necessarily, but sometimes you need them to explain things, and sometimes you need just the specific answers because you need to drive the investigation. And then actively listening is also important. The biggest piece of advice I can give you is that you can go very far in this world with an open mind and a closed mouth. Family preference issues. The family may try to make the transport decision for the patient. The patient has the right to make their own decisions unless they're altered in one of these ways, right? Inebriated, or something's going on to make them altered. Finally, hostile patients. This is something that we might encounter. People generally call 911 when they're having one of the worst days of their lives. All right. So it's important to keep that in mind. People will also respond angrily. When people are suffering, they respond out by being angry because sometimes it's cathartic to be angry, or it feels like it would be cathartic to be angry. Realistically, when we strike out to make other people feel bad, to make ourselves feel better, we just make them feel bad. And when people are suffering, they tend to react with anger. It's a cyclical process. When someone is angry, it's because they are suffering. And it's important to remember that as an act of compassion. What really helps with that, and I know this might seem a little out of the ordinary, but what has helped me with that is meditation and things like that. Because I used to have some anger issues. I used to put holes in the drywall, when I would lose video games. Those are things that you can overcome. You need to understand that just because you're suffering does not mean that anger is going to be the way that you can take it out. I still struggle with that sometimes, but it's helped significantly, I would say. Communicating with children. If you guys have kids, this will be easier for you, right? Mr. Rogers said it the best. Remember, you were a child once too. Children don't have a lot of agency in what's going on around them, and they don't have a lot of understanding in what's going on around them, depending on their age. This can be very overwhelming for them. So it's important to try to explain things very carefully to them, and then try to put their minds at ease, saying, hey, look, I'm not going to poke you. We don't need to poke you with a needle or anything. They might have to do that at the hospital. We'll see. Okay. Let's just take you in the hospital. We need to get you checked out. And if you do need to give them a poke, it's better just to not tell them about it until you're about to do it. That's my piece of advice. Don't let them see the needle. The longer they're looking at the needle, the longer they're going to freak out. And by the way, that's not just kids. That's all patients. Every time I have a patient that says they don't like needles, I always reply back to them, that's okay. I like them just fine. And then I make them laugh, and then you do it. Just give them the stick right away. Little pro tip for you guys. If you do have a patient that does not like needles, tell them to look away. Tell them you'll give them a countdown, and then give them an alcohol prep pad to sniff. And then tell them to take a big inhale right when you give the poke, and that will generally distract them enough for you to get the poke in. Because realistically, IVs don't hurt that much. It hurts when you're fishing and they're uncomfortable, but the most of the pain comes right when you're stabbing them in. Document everything as well as you can afterwards. Your documentation is going to be what protects you. So it needs to be a very clearly outlined events of what happened, objectively written. You can't write the patient is drunk unless the patient states they're drunk, in which case you'll report patient states they are, in quotes, drunk and had, in quotes, 6 beers or whatever they say. All right. And then you can also say things like they have an unsteady gait and nystagmus is noted. Nystagmus is an eye indicator you can look for, where you hold your finger in front of them and move it from side to side, and they're trying to follow your finger. They're exhibiting nystagmus when the eyes are moving in a very jerky manner. Normally, your eyes will move very slowly left to right without your head moving. But when we're drunk or our central nervous system is depressed, it'll tend to be a little more jerky, which is just a sign that they're not necessarily that they're drunk, just that their central nervous system is slightly depressed. Nystagmus noted, slurred speech, unsteady gait. These all imply inebriation without directly stating inebriation. All right. And the narrative should include everything. But I can go over narrative stuff for you guys a little bit later if you want. Documentation is ultimately very important, and you should do it as quickly as you can after the call. All right. History taking. Obtaining a medical history is not simply gathering facts. As you gather information, your patient begins to build trust in you and the care you're providing. Here in San Diego, we have it simplified into a little acronym called HAM, H-A-M. History, allergies, medications. Those are the 3 big things I'm looking for from a patient, right? If I can figure out those, especially their history and their medications, I can tell a lot about what the patient's going through. Those are very important. Initial information you may need to gather will be date and time, age, gender, race, blah, blah, blah. Source of their medical history. Is the patient a reliable historian? Sometimes they will be, sometimes they won't. If not, who supplied their medical history? Family member, care provider, just someone off the street? Medical record may be the only source of information you have for the patient. Their chief complaint is their main thing they're complaining about, obviously. Abdominal pain, chest pain, shortness of breath, traumatic injury, whatever it might be. Documenting it in their exact words is helpful. Most of the information concerning the patient encounter will be under the HPI, the history of the present illness. Full, concise chronological account of the patient's symptoms, as well as any past medical events and illnesses. As you guys may or may not be aware, certain medical problems are more likely to lead to other medical problems. For example, if you've had a heart attack, you're more likely to have more heart attacks. If you've had a TIA, you're more likely to have a stroke. If you have diabetes type 2, you're more likely to have everything. Okay, diabetes is devastating to the human body. We'll talk about that a little bit later. We're going over the endocrine system, as well as their current health. This is what I was talking about earlier. What's the state that they're living in, their home, things like that. Immunization history, diet, sleep, exercise. We might not be able to get all this information, but it helps give us a more thorough picture of the patient's presentation. Any cardiac history, cancer history, diabetes, mellitus, the type of diabetes we're more familiar with, drug addiction, alcoholism, hypertension, kidney disease, stroke. Hypertension, very damaging to the body. Diabetes, very damaging to the body. Obviously, all these other ones are damaging, but hypertension and diabetes are much more common that we run into. and they can be very big indicators of future medical problems. Is the patient able to function in their daily society, going about doing things? Not always. Sometimes it can be very difficult for them. Although a paramedic would have asked about associated symptoms in reference to the chief complaint, the following review of each symptoms may be helpful in remembering subtle information that may make it easier to pinpoint the cause of the patient's distress. So these are things that are helpful to ask them about. How has your diet been? Now, remember, think back to OPQRST and sample. OPQRST refers to the event that they're undergoing right now, okay? Sample is more their generalized history. And remember what it means, okay? That sample is the signs and symptoms. That's all the OPQRST stuff, all right? The rest of it is really ample. That should be the acronym that you remember. A, allergies. M, medications. P, past pertinent medical history. So again, remember I told you that ham analogy earlier? That's basically the AMP, past pertinent medical history. L would be the last oral intake, meaning the last time they ate or drank anything. This might be important if they need to have surgery later. And we also want to know about alcohol. Finally, the E are the events leading up to it. So what were you doing when this happened? For example, let's say someone has a syncopal episode and they fall down. What were you doing? Were you sitting in your chair watching TV, or were you outside in the sun washing your car? Those are two different considerations for what could potentially have caused them to pass out, right? So just asking ample might help you to get through your assessments a little more clearly, okay? Diet is very important. Along with diet, their bowel movements. We can tell a lot about people's bowel movements. I'm going to go over some stuff that's kind of interesting from the GI system when we get to it. Also interested in caffeine. You're going to show up and people are going to be tachycardic, freaking out, having anxiety, having heart palpitations. Have you been taking any pre-workout, right? That stuff can be devastating. It's completely unregulated. It's very dangerous. Are you taking any pills? Drinking Red Bulls, drinking Monster energy drinks? How many cups of coffee have you had today? Have you been drinking soda, sugar? What can be possibly causing this? Their general symptoms. Remember the difference between a sign and a symptom. A sign is something that I can directly measure. Your SpO2, your heart rate, your respiratory rate, the quality of your breathing. These are things I can listen to and get definitive answers on. A symptom is something that you experience, but I can't experience through any of my diagnostic tools. For example, a headache. A headache is a very real thing. So is abdominal pain. I can't measure abdominal pain. I can't measure a headache. I can measure a pain scale, but that's a sign. But a symptom would be something that's immeasurable. Look at their skin. People's skin is going to show changes very quickly. Our skin is our most impressive organ. Well, it's one of our most impressive organs. It's also the biggest organ in the human body, and it's the only organ that we can see clearly from the outside, or it's one of the only organs we can see very clearly. Finally, their vision, their eyes. Eyes will tell us a lot about not only the person's mentation, but their central nervous system, right? We know that the parasympathetic and sympathetic nervous systems directly change your pupil size, which we'll go over. Looking at their throat for any swelling, cough, hoarseness, tightness, dysphagia, the inability to swallow or problems swallowing, choking, heartburn, bleeding gums, stiff neck, swollen glands. Their cough, is it productive? What's the color of it? How much? And finally, chest pain, palpitations, peripheral edema, dyspnea, orthopnea. And again, their GI and GU problems. How's your urine output been? Have you been peeing and pooping normally? Right? These are really interesting questions that can help you understand. Someone's got abdominal pain and they're a female. Here's an important question. Where are you having your menstrual cycle? I've literally gotten 911 calls for girls having their menstrual cycle, having their first menstrual cycle. It happens especially when they're like in weirdly religious homes where the parents like don't want to talk about, sex or maturity or puberty in these ways. And so their daughter's not feeling good and she starts bleeding and they call 911. And I've literally been like looking at the mom like, don't you understand what's going on here? She's 11. She's having her first period. Like, you're a woman. Shouldn't you understand? I can't explain it. I've literally had that call multiple times in my career where I get called for someone having their first period. One time it was at a school, and the girl, again, just didn't know what was going on. And the school nurse called us in, and we had to explain everything that's going on. And we ended up taking her to the hospital just to get checked out. She was fine, but kind of surprising sometimes. Remember, most people don't know anything about medicine, okay? And unfortunately, a lot of people don't know about their own bodies. By the way, anytime you get a girl who's got abdominal pain, you need to ask her a very difficult question, which is, hey, is there any chance that you could be pregnant right now? Now, most of the time, they're going to give you the answer like laughing in your face saying, hell no, but occasionally it might be the case. Very important to remember. Now, we are also able to ask this stuff. Try going up to some random woman on the street and ask her when her last menstrual cycle was, how much she weighs, and what her social security number is, and see what kind of reaction you get. Now, drive around in a big red truck with a blue outfit with a badge on and ask those same questions, and you're going to get answers. All right. People are willing to volunteer this information to us, and you need to take advantage of that and utilize it, and also, be respectful of it. I'm not asking you how much you weigh because I'm going to call you fat. I'm asking how much you weigh because it's going to affect the amount of medications I give you. And by the way, for pain meds, I always say they weigh 5 pounds more. Like, pain meds add 5 pounds, right? Just like the camera does. Finally, look at think about the different body systems that could be affected. Their immune system, their CNS, or their neurological system, their endocrine system, which we'll go over here, as well as their general mood. How many of our calls would you guys say are psychiatric, or have a psychiatric component to them? Now, if you're going to break down how many of our calls are pure psych calls, maybe 20%, maybe higher, depending on areas you run in. But if you want to talk about calls that involve some psych component, it's high. I would say it's as high as 70%. Because realistically, most people are able to handle themselves when they get hurt or when they get sick. How many times have you guys ridden in an ambulance to the hospital? I'm going to guess it's maybe once, maybe twice if it was like true life-threatening emergencies, probably zero. Okay? We're the average. Most people don't call 911 frequently. 911 is a once-in-a-lifetime sort of thing for them. Again, most people we're transporting are frequent flyers, meaning that they are lacking whatever faculties they might need in order to deal with this situation in a reasonable way. And that's part of the problem.